Okay, so we're going to go through what a microcurrent therapy session will look like. So we're going to do a full body, and we're going to work on the upper body first, and then move on to the lower part. Okay, so we're going to get Dara set up here. Now we're going to start the machines, and the machines will actually tell you where is tight, where there's any scar tissue, and you can see that pulling there already. Okay, so we're going to clear out the neck, any issues going on in the neck. We're going on the front delts, we're doing the subscaps, we're doing the triceps and biceps. Okay. As you can see, the machines can do a lot of work without me even touching them. They're going to find what side is actually needs some work, which one is holding any scar tissue, any restrictions. So I'm going to let that run. You can see the right in comparison to the left. So there is holding some restrictions there on the right on the neck. So we're going to let that run there for a few minutes in Dara. Microcurrent therapy is a drug-free, non-invasive approach to pain relief and healing. It works by using ultra-low level electrical currents that mimic the body's natural bioelectrical signals, which are already running through your body. We utilize these to repair damaged tissue, reduce inflammation, and restore normal function. Microcurrent helps the body heal at the root and will stay working in the body for 12 hours. What can microcurrent do for you? Decrease pain levels, increase range of motion, remove scar tissue, restore normal function. I qualified in microcurrent therapy in 2019 and I have been using it to date, working on injuries like sprains, strains, tears, post-surgeries like knee replacements, ankle fusion, Achilles ruptures, and so on. So like microcurrent therapy are the machines that devices can do without me even touching them. They're finding out where it actually needs a bit of work. Okay, so we know Dara's right hand side is needing a lot of work. Okay, so you can see the current working the whole way down the tricep, into the bicep, into the fingers. Okay, so working on the tricep, clearing any scar tissue, and you can see that massive pull that is going on. Okay, so that's clearing all the scarring down that arm, and we can hit the bicep while we're on it, clearing any issues going on there. Okay, so we're going to move on to the subscaps. So working on the triceps, working on the biceps. For any issues with tennis elbow, golfer's elbow, carpal tunnel, this will free out that whole arm and get it back functioning properly. Okay, so we're going to move on to the subscap. We're getting in, just clearing any restrictions, any scar tissue there. We're just searching around. Like I said, the microcurrent, we could just leave it on there, but what I'm doing, I'm searching for any deeper issues, like any restrictions, scar tissue, and just getting in a lot deeper. So anybody with a frozen shoulder, any shoulder impingements, anything like that, that's great. So we can work on the lats, whole way down the back, and you feel that massive pull. Getting right up into the shoulder joint, and you're going to have full range of motion when we're done with this. Okay, we hit the pecs as well while we're here, so we're hitting massive amounts of muscle. We can get a lot of treatment done in one session. Okay, we're moving on to the neck. So we're going to clear out any tightness in the neck, any scar tissue in the neck. So if you have any neck pain, any restrictions turning your head, headaches, anything like that. So we're working on the levator scapula, and then we're going to go down onto SCM. So make sure that everything is cleared out. As I'm just using the pads here, I'm just searching for any that tightness that needs a little bit extra work. So you can see Dara has massive pulls on the right, and you're going to feel that current going through the body, and you're going to get massive relief when we're done. Okay, so we've Dara set up here for the lower leg. So we're going to start on the adductors. Okay, so anybody with the likes of hamstring, groin pain, osteitis pubis, hip impingements, this will, like I said before, get rid of scar tissue and get you back full range of motion. Okay, so with the bigger muscles here, it will still stay working, but I'm just going in a little bit deeper to get that reaction, okay, and get that current deep into the muscle. So we're hitting the hamstrings here, so we can clear out the hamstrings, and then we're going to move on to the adductors. Okay, so anybody that's playing sport, any footballers that find that their hips are stiff and sore and you just have that little restriction, this is going to get them moving big time. Okay, and you can see Dara is nice and chilled and relaxed. Okay, so the mic current, it's not sore, just an unusual sensation, and the more relaxed and switched off the client is, we're going to get maximum benefit from it. Okay, you're going to get nice big pulls on the hamstrings up into the adductors. Again, for lower back pain, we would use this kind of treatment to free up any restrictions going on there. Okay, so we're going into the lower body. Okay, we're going to hit the hip flexors here onto the quads. So again, this is going to be great for any injuries, like runners, any hip flexor issues, knee issues, patellar tendonitis, runner's knee, jumper's knee. Let's see that reaction. Okay, so we'll let them run and clear out any restrictions. You can see how much work the microcurrent is actually getting done. So clearing the whole way down. Okay, so we're going to do a little treatment here on the calf. So any calf injuries, Achilles injuries, plantar fasciitis, ankle restrictions, we're going to show you how the microcurrent can actually release that out. Okay, just going to wet this point here, and we're going in with the microcurrent, so nice and relaxed, and you'll see the reaction we're going to get. So clearing out any issues that are going in the calf. You see the current working right through to the feet. Again, nice little release there in the ankle. So any restrictions in the ankle, it's going to release that out. There we go, nice little pop in the ankle. So calf pain, Achilles pain, heel pain, plantar fasciitis, any of that the microcurrent will get rid of the scar tissue, get rid of the restrictions that is stopping that ankle from moving, and get everything back working as normal. So microcurrent therapy is the equivalent of actually getting 10 hours of actually hands-on work done. So you get a massive amount of work done in one session. Like I said, the current will stay working in the body up to 12 hours. For that to do so, the tissues need to be well hydrated. So plenty of fluids in the body will help the current pass through the body, and you're going to get the best results. Okay, so we've done a full treatment of microcurrent on Dara, and I'm going to get Dara to describe how it actually feels when the current is going through the body.
So I suppose with the current, it's just like a tingling sensation, and it feels just like a really deep treatment. So it's really getting to the points that need clearing. When it's hitting those points, basically you get that really big contraction. It can be intense for a couple of seconds, and then afterwards that's when you get that release, and you feel really good and really loose afterwards. And even just from my own training, from running and rugby and so on, it's definitely the best type of treatment to kind of keep on top of all those little niggles.
So the best approach for what I can say for any clients that are thinking of getting microcurrent therapy done is to come well hydrated and just be nice and chilled, relaxed. Okay, it's nothing to be scared of. You will feel a current. It'll feel, like Dara was saying, a tingle, and it will pull the muscles like you've seen on the video. But the effect that it can have on the body, and the release and the relief and the range of motion that you're going to have is going to be phenomenal, right? Yeah. And you're going to feel amazing after it. Okay, so it's to come well hydrated, and even after, like I was saying, it's going to continue working in the body for 12 hours. So you're getting a double whammy of a treatment in one session. The only people that we can't treat would be anybody with a pacemaker, or if you're pregnant. Okay, they're the only two. Anybody else we're pretty much able to treat. You're going to feel, if you're coming in pain, it will decrease pain, and depends on if you have an injury and it's been there for a couple of years or it might take a few sessions to break down scar tissue and get that tissue back to normal. Okay, if it's a recent injury, say 6 months or that, you can break down scar tissue pretty quick. Okay, so that's just a snippet today of what microcurrent can do. And thank you, Dara, for being a great client, and thank you, Dylan.